Happy New Week. Many thanks for joining us for the program. The news in detail with me, Gloria Mutesi. Starting us off tonight, Rwanda and the Central African Republic are going to establish a joint task force meant to promote trade and cooperation when it comes to agriculture and animal husbandry. The announcement was made on Monday as the Minister of Agriculture and Rural Development of the Central African Republic began a 3-day working visit in Rwanda. Stationary begins our coverage tonight.
On day one of his visit in the country, Minister Eric Rokose Kamo toured Inyanje Industries and immediately noticed an opportunity for his country and Rwanda to benefit from cooperation.
Aujourd'hui, nous avons découvert ici au Inyanje que l'Inyanje importe des mangues depuis l'Inde.
Today we learned that Inyanje imports mangoes from India, and that could be up to 10,000 kilometers away. Yet the Central African Republic is just 2,000 to 3,000 kilometers away, and we have very fertile soil. So we can carry out a feasibility study on how we can work together to grow and process those mangoes. That is the type of cooperation we wish to establish.
Voilà, c'est ce type de coopération que nous voulons établir.
Indeed, Inyanje Industries does struggle to import mangoes from as far away as India and Germany. Yet its factory is able to produce up to 200,000 liters of beverages every single day. Its managing director agrees that sourcing such things from the Central African Republic would be far more profitable for all parties concerned. We believe that if we were to go there and establish a processing plant in collaboration with the authorities in the Central African Republic, we would be able to meet our own demand. One, we would be able to manage farmers, ensure our own produce and bring it here for processing. Automatically, you reduce the costs of having to buy that produce from other companies in India and importing it here. It is without a doubt much cheaper. Every day we are seeing opportunities in different African countries.
So almost kuundi tunaona ko cyane muri ibihugu bya Afrika hari opportunity.
Government officials here in Rwanda have pointed out that the political will exists between both countries to utilize such opportunities. A number of cooperation agreements have been signed, including in agriculture to do with long-term cooperation in capacity building and the trade of agricultural produce. We have talked about the opportunities that exist in their country that can benefit all of us. They have vast fertile land that they want us to help make productive enough to supply processing plants and factories so that both countries can engage in trade in that specific sector. The minister is therefore here to see for himself what sort of opportunities are available for them, and that is why we gave him a tour of Inyanje. Next, we are going to establish a task force of technicians so that they begin the implementation phase of things.
This
visit from the Minister of Agriculture and Rural Development of the Central African Republic comes after Rwanda's Minister of State in the Ministry of Agriculture and Animal Resources visited the Central African Republic in August this year, and CAR's president also visited Rwanda in August.
Now, some residents say that efforts made to treat HIV, tuberculosis and malaria have helped protect them against diseases along with those at most risk of contracting the diseases. This is while Rwanda has been partnering with the Global Fund for the last 20 years in terms of treating these diseases. Various organizations working in the health sector in collaboration with the Ministry of Health have organized an event to commemorate the last 20 years of the Global Fund being a partner of Rwanda in the treatment of HIV, tuberculosis and malaria. Some of the work done over the past 20 years has included easing access to TB medicines and ARVs at no cost, distributing mosquito nets, spraying mosquito repellents in people's homes, among other things. Residents, including Isabel Nizeimana, who has been living with HIV for more than 25 years, say that they value the treatment given for these diseases. It was a death sentence before the drugs were available. We didn't have hope. We started getting drugs in 2003 through the Global Fund. These drugs came along with food aid because many people needed it. In addition to that was the health insurance and education for families of those that were battling HIV. Hope was then restored for life.
bagira ikizere cy'ubuzima. Impamvu malariya mbere yakwirakwiraga inzitiramibu ntago abaturage ntago bamwe bayumvaga bumvaga ko ari ibintu by'umuhango.
Malaria was very prevalent before we didn't know the value of mosquito nets. We thought it was like a ritual, but currently we can't sleep without mosquito nets. We ensure that our children are under 1-2 as they go to sleep. We have swamps around, so we take all the precaution. The permanent secretary in the Ministry of Health, Zachary Iyakaremye, says the Global Fund has provided more than $1 billion in aid to Rwanda since 2003 and that the collaboration should continue, considering the success of the work that has been done.
Muri 2016 niho tushaka kuba twaragize imibare myinshi y'abandura malaria yageraga kuri miliyoni 5.
In 2016, we had a high number of malaria cases reaching up to 5 million. In collaboration with the Global Fund and the implementation of various methods of eradication based on each region, together with other remedies, all that led to a decrease in the number of people infected with malaria to 500,000 annually and 70 deaths. We wish that no one dies of malaria currently. The Global Fund's goal is that by 2030 no one will be contracting malaria, HIV or tuberculosis, which is a major goal that requires cooperation, including with the Global Fund.
Ibyo rero ni intego ikomeye ku buryo ubufatanye bwa buri wese harimo na Global Fund bugikenewe.
Linda Mafu, the head of political and civil society departments of the Global Fund to fight AIDS, TB and malaria, says Global Fund's work has lifted families from grief over the loss of their loved ones from diseases like tuberculosis and malaria.
The activists were on the street calling for a game changer. They were on the streets calling for an equalizer that would ensure that everyone have access to treatment, everyone has access to health services, irrespective of their ability or inability to pay. And that was very, very key. So we all got on the street, we had conversations in the boardrooms, we had conversations everywhere. The donor leadership was very important, and the donors stood up and said, we can mobilize resources, we can put resources together. With the results report that has come out, we have saved 44 million lives. I am one of the 38 million lives. I am one of the 44 million lives.
The Global Fund has established that its activities since 2002 are valued at about $4 billion annually, helping to protect the lives of 44 million people globally. In more than 100 countries where the Global Fund has been operating since 2002, the number of deaths from HIV/AIDS has dropped by 61%. The number of deaths from tuberculosis has decreased by 25%, and the number of deaths from malaria has decreased by 46%. Now, a one-month campaign has been launched in sectors of Kigali city to combat and contain the spread of the COVID-19 pandemic. The sector that will win will be awarded a vehicle provided by the Rwanda National Police in collaboration with the city of Kigali. Gabi Muvunyi has the details.
This campaign is meant to fight and control the COVID-19 pandemic and has been launched in all sectors of Kigali city. Niboye sector is one of the sectors that use a drone to broadcast public messages in populated areas such as markets, neighborhoods, and in schools. And similar messages are being delivered in other various sectors. Some of the residents in various sectors in Kigali say that this campaign is a solution because people have become careless after being vaccinated.
Mu byukuri ntabwo navuga yuko twabyina insinzi kubera yuko
We put all our efforts in spreading awareness door to door so that every single person is aware of the preventive measures, because COVID-19 kills people and many people have stopped working and don't have money. But if we join hands and fight this pandemic, we shall go back to the way life was.
Twakagombye kwirinda kugira ngo tutazongera gusubira muri guma mu rugo.
Sector executive secretaries note that although this is a competition, it is also a way to raise public awareness to further remind people that the COVID-19 pandemic is still ongoing. We choose not to give up on fighting this pandemic, where we are using drones to deliver public messages in order to raise awareness, as well as other methods. We choose this method for areas that are sparsely populated. Therefore, I am certain that it is us who will win the car. For the performance contract that we signed with all the leaders, it will ensure that we follow it through.
ni ukuvuga ngo ubwo bufatanye buri muri ibyo byose buzatuma tugeza
imbaraga turazishyira ahurira abantu benshi imbaraga tukazishyira nanone mu kwita ku.
We shall put efforts in populated areas and will be attending to the few positive cases that we still have, including those in home-based care, in collaboration with health institutions, and also we shall put efforts in markets and churches that have now been opened.
These leaders signed a performance contract alongside the settlement and neighborhood leaders so that for those that fail to exhibit commitment in fighting the COVID-19 pandemic will be held accountable. The campaign, which started on Monday, September 13th, will run through to October 19th, 2021, where at the end, a car will be awarded to the sector that has been committed to reducing and containing the spread of COVID-19. Gabi Muvunyi, reporting for RTV News.
The 2019-2020 Auditor General's report indicated that more than 21 billion Rwanda francs in tenders were not properly issued by the Rwanda Agriculture Board following the regulations and laws in place, and officials at RAB have given assurances to members of the Parliamentary Public Accounts Committee that reforms have begun in the way the institution awards tenders and manages its finances.
The Auditor General's report in question indicated that the overwhelming incidents of malpractice found at the Rwanda Agriculture Board centered on the issuing of tenders that was not done in transparency and accounts for billions of Rwandan francs, resulting in officials from the institute being summoned by the Parliamentary Public Accounts Committee to explain themselves during a public hearing.
If indeed the problem is limited staff, do you really think there's reason enough to alter records of tenders to appease contractors? Do you really think that that is an answer that will satisfy us? We cannot accept that answer.
The fact that mistakes were found and incidents of malpractice were also noted. I wanted to ask you if you are unable to respect the laws governing the issuing of public tenders here in Rwanda. Which country's laws were you using?
Maybe mistakes can be made in one or two tenders, but how can you say that limited staff is the reason for malpractice appearing in 10 public tenders? That is not logical. I want you to explain to us what disciplinary measures were implemented against employees who were found to engage in wrongdoing.
Numerous incidents of malpractice, as highlighted by the Auditor General's report, were brought under the spotlight, and the Director General of RAB assured the parliamentarians that the matter is being addressed and any wrongdoers have been punished. We have adopted reforms to address it and recently carried out a restructure that should help us in this regard. Our finance department was facing serious problems of capacity and professionalism, and we have now digitalized our filing system for easy access and verification. The latest restructure has strengthened our finance department significantly, and we will now be able to closely monitor the work done by all employees. 4 people in the finance department were dismissed following that Auditor General's report. We now have 5 employees in charge of the tenders instead of just 2, and training for them has also increased. The 2019-2020 Auditor General's report issued an adverse opinion for RAB because of the malpractice that was uncovered. Officials from the Institute's affiliate projects and partners also appeared before PAC to explain themselves.
Also in the news today, the East African community has called for Rwanda's border with the Democratic Republic of Congo, running between the towns of Gisenyi and Goma, provide more infrastructure that will help in the fight against the spread of the COVID-19 pandemic. The call was made during the visit from the EAC Deputy Secretary General Honorable Christophe Bazivamo and his delegation to Rubavu District. Gabi Muvuni has the details.
300 million Rwandan francs has been allocated by the East African community to Rwanda's border with the DRC, running between the towns of Gisenyi and Goma, in order to provide the cross-border travelers with more infrastructure that will help in the fight against the spread of COVID-19. The East African Community's Deputy Secretary General and his delegation note that the project would be carried out at 12 borders in 6 member states with a budget of nearly 2 billion Rwandan francs. He called on districts at the border to speed up and plan what needs to be done because the project will last only 3 months.
The project needs to be done by December this year. That means in the next 3 months. What we ask is that they should all come together and plan so that when it comes to executing the project, they are all working at the same speed without delaying others. However, when the Deputy Secretary General arrived at the small border known as Petit Barrière, he noted out the influx of people waiting in line for permission to enter Goma, noting there is a clear violation of the COVID-19 preventive guidelines. There aren't any COVID-19 guidelines we're following here, like there isn't any social distancing because we want to get in front of the line. They charge us money to cross the border, so when we don't have the money, they do not attend to you. Among the things that urgently need to be addressed by the project include to increase the number of stations people wash their hands, as well as one for children and for those who are disabled, and to also increase awareness to remind people on the COVID-19 preventive measures. There is infrastructure, but the problem is that it is not enough. We had put some washing stations for those that are coming from Goma, but for those that are coming from Rwanda to Goma, there aren't any. That is where we want to put our efforts to cater for the large number of cross-border travelers that are here. The Deputy Secretary General of the EAC notes they have not come across any reasons as to why they cannot accept the DRC into the East African community. In the report that was carried out, it shows that there is no reason as to why we cannot accept the DRC into the East African community. They also show will and have attained all that the EAC has requested of them. Now what is left is for that report to be overlooked at the President's meeting, and we shall know the way forward. Apart from the projects to contain COVID-19, there are also projects such as the single customs territory in a bid to ease cross-border trade and cut down on the time goods spent on the road, and to establish a single currency with the Central Bank of the East African Community. Gabi Muvunyi, reporting for RTV News.